So our service pledge brings patients, healthcare professionals and cancer alliances together to work in partnership to design and deliver improvements in a practical and achievable way. We recognise that patient experience is as important as clinical outcomes. We also recognise that staff engagement and experience has a huge impact on patient experience. And this is why we ensure that hospital staff are involved as an equal stakeholder alongside local patients in our work. In 2019, with sponsorship from Pfizer, we piloted a new approach where we worked across a Cancer Alliance, comparing patient experience feedback across services. So this was both sort of between different hospitals in the region, but also between primary and secondary breast cancer diagnoses. And really the idea is that by working at that Cancer Alliance level and working with individual services, we aim to reduce variation in patient experience by encouraging co-production, peer learning and sharing best practice. Next slide. So in terms of the rationale and need, I suppose, for the service pledge, as I mentioned, patient experience is linked to clinical outcomes. I'm sure I don't need to tell everyone here that, preaching to the choir. Certainly from a breast cancer perspective, it can result, a positive patient experience can result in fewer A&E admissions, fewer kind of negative impacts from side effects of treatment, even better treatment adherence at times. In terms of looking at both primary and secondary breast cancer, we know that they both got their own unique challenges, and research can show that people with secondary breast cancer often experience a poorer level of or poorer experience of care than people with a primary diagnosis. But we also know that the general principles of good patient experience are similar regardless of diagnosis. So again, by working holistically across all breast cancer services, we want to facilitate that peer learning and sharing best practice so that really we can kind of help accelerate the innovation and improvement for patient experience across the board. We felt it was important that our programme aligns with the NHS long-term plan, really to support services in delivering that alongside the increasing challenges that everyone is facing. And speaking of challenges, COVID-19 was a curveball that, most of us weren't expecting. And obviously that resulted in a lot of setbacks for breast cancer services, but it did also encourage a lot of innovation across the NHS. And with the service pledge, we do focus on identifying areas for improvement, but we also want to make sure we're highlighting good practice. So really supporting those services, now we're sort of in that sort of COVID world of not only identifying where there've been challenges and issues they need to address, but also where some of those innovations have improved patient experience and they might want to keep and maintain that in their new normal. Next slide. So in terms of our reach, we've been delivering the service pledge since 2003, and we've worked with over 120 breast cancer services across the UK. We've helped to identify over 400 improvements in the last 5 years alone. And in terms of the sort of, I suppose, relevance and reach of our work, it's obviously relevant to all stakeholders involved in providing treatment and care for breast cancer patients. And for us, that includes both clinical but also administrative staff. And we do try and involve the whole kind of hospital team across the board in our work. Also, as the service pledge is really based on kind of key principles of patient involvement and co-design, its relevance is broader than just breast cancer. So, the method really could be used for evaluating and improving patient experience in other tumour sites or healthcare settings. And this is something that West Yorkshire and Harrogate Cancer Alliance has started to explore, having worked with us in 2018. We also tried to kind of expand the impact and reach of the service pledge by sharing our insights internally within the organisation of Breast Cancer Now. So insights we get on, what really impacts patient experience and what challenges NHS staff are facing. We share that with our colleagues to help inform our wider charitable work as well. Next slide. So that's a bit about sort of rationale and our reach. Now I just want to talk through how the service pledge programme actually works. And for me, I think our real strength is that the partnership working between healthcare professionals and people affected by breast cancer is really embedded throughout the process. We collect patient and hospital staff feedback through surveys and focus groups. Breast Cancer Now staff, my team review that feedback and identify themes, but we do that in partnership with our volunteer patient advocates. We share that insight with local patients and hospital staff in a detailed report, and we invite local patients to become patient representatives and work alongside ourselves, our volunteer patient advocates and their hospital staff to really help identify the priorities for improvement for patient experience. We facilitate improvement discussions between hospital staff, our volunteer patient advocates and local patient representatives. And you can see here, I've just got some photos and some quotes from a pre-COVID meeting that we held in Leeds in 2018. And really through sort of listening and learning from each other, patients and healthcare professionals do work in a true partnership. And this really helps each breast cancer service to develop their own individual action plan to ensure that the improvements they've identified are both smart and sustainable. We're also keen to encourage a plan, do, study, act approach. We know it's a continuous process. It's not kind of come in, fix everything and go away. So we really want to kind of encourage that way of thinking when it comes to implementing improvements for patient experience. As part of the new approach that we piloted in 2019, we organised a virtual event where we brought patients and breast cancer services across the Cancer Alliance together to share their progress on how they were getting on with their service pledge action plan. And this really was an opportunity for staff to learn from each other's successes, but also to share the challenges and where things maybe hadn't gone so well, and really help to kind of provide peer support and advice to each other, share each other's learnings, and also continue that conversation with their patients on what changes were working, what was still a challenge for people. So really, again, encouraging that conversation to continue. Next slide. Lovely. So in terms of our impact, in the past 18 months, I work with 5 hospitals in the East of England South Cancer Alliance. We've helped to identify over 40 improvements. You can see here there's a few examples of some of those that are being made as a result of the service pledge. And also there's a quote on the right from Ginny, the head of transformation. And the reason that I wanted to kind of include the quote was obviously the support from the Cancer Alliance is really key, and as well as encouraging individual hospitals to make changes and identify their own action plans, we'll also try to encourage and work closely with the Cancer Alliance to look at what regionally needs to be changed or built on. And the Cancer Alliance, the East of England Cancer Alliance, is now looking at rolling out basically kind of a signposting system to help signpost patients locally to support services across hospitals in their region, and that was as a result of the service pledge feedback. In terms of evaluating our impact, we use theory of change and evaluation framework, and we don't just sort of monitor and evaluate the process as we go through, but we also do longer term follow-up. So every 6 months up to 18 months, we follow up with the hospitals to see how they're getting on and the longer term impact of the changes that they're making. Many patients report that being involved in the service pledge helps them grow in confidence and turn something negative into something positive for others. And the healthcare professionals that were involved in our work in the East of England reported that both themselves and their team had an improved understanding of patient perspective as a result of the service pledge. Next slide. So we've been delivering this for nearly 20 years, so we have a lot more learnings than I can fit in the 10 minutes. But just to give a bit of an idea, flexible approach is key. We know one size doesn't fit all. COVID, again, has meant that we've had to be even more flexible. But for us, it's been great. We could innovate, and we've actually moved a lot of our meetings and focus groups online, which has made it more accessible, hopefully, for patients. But as you can see further down, I've noted digital exclusion. That is something we are aware of for some patients. Digital is great, they don't have to travel, but for others that can be a barrier. So that's something we're looking at. Working across the Cancer Alliance has really helped. It helps us to encourage that peer learning across trusts and make the connections where trusts are already coming together. Lead cancer nurses are meeting across the Alliance and we can tap into that. Also, it helps us to engage with grassroots organisations, which we're hoping will help us to improve the diversity of the people that we engage and work with on this. Final slide. Oh, no, sorry, next slide. Yep, not final, sorry. Just to sum up, the service pledge embeds a culture of meaningful patient involvement and provides valuable insight into the challenges faced by patients and NHS staff. In terms of what's next, we're now looking to work with NHS Lothian in Scotland. We're also working with East of England North Cancer Alliance, which is linked to the South, where we've already worked. And we're hoping to work with another cancer alliance this year as well, to be confirmed. Final slide. And just want to leave you with a quote from Beverly. She was a patient rep with us in 2018 in Yorkshire, and then she went on to become a volunteer patient advocate with us in 2020 for East of England. Thank you very much.